Hello, my name is Laurie Schadegg Thomas, and I'm the Vice President of Strategic Development for Consonus Healthcare. I'm here this morning, 6 feet away, from Phil Fogg, our CEO and the Vice Chair of the American Healthcare Association.
Good morning.
Normally this time of year, we see many of you at trade shows around the country, where we're able to share what Marquis and Consonus Healthcare are doing to work through the challenges our industry faces. Though given the current COVID-19 situation, we can't connect with you in that way, we still think it's important to be your trusted advisor. We feel we're uniquely qualified to be a resource both as a senior care provider through Marquis and as a rehab and pharmacy provider for many of you across the country.
That's true, Laurie. This has been a journey we've all been going through. Many of you have been reaching out as you have had issues arise. It feels like I've made more decisions in the last 6 weeks than the previous 6 years, most of which were very situational with multiple variables or essentially not easy decisions. Like you, we have been focused on the immediate issues, adapting to the changing CMS, CDC, executive orders, and all of the state health authority directives, preventing or containing the coronavirus and all the infection prevention programs, developing new ways to communicate in real time with our staff and our families, managing media communications, dealing with a myriad of HR and staffing issues, and most importantly, getting PPE in a very scarce world. All of you have been impacted in different ways. So we are reaching out to you today to find out how we can be most helpful. We do not want to presume. And I think you also know that we don't profess to have everything right. We can ask from all of you if there is a best practice out there as well.
Right. That's why we're here today. If you've been receiving our monthly newsletter, you'll notice it will be taking a little bit different format. We'll be providing you with the most important guidance and perspectives based on what we've learned so far through the COVID-19 pandemic, and creating a frequently asked question resource that's tailored to your specific needs. So Phil, I'm wondering if you could just share a few high-level insights about what we've learned so far and what the future is likely to hold. These would be the sorts of things that we'd cover in future installments of the newsletter.
Sure. So we've all learned how to navigate through a pandemic outbreak now. All of the hard decisions I was just talking about were being made for the very first time, which is what made them really hard. There was no existing playbook to draw lessons from. But now we must start to figure out how to move forward, and that means projecting when the COVID-19 cases will peak, decline, and what that means to when hospital discharge patterns will resume and progress back to normal. We then need to develop financial projections on what the next 3 to 6 months will look like and what the cash flow implications are to all of us.
So let's start with what are some of the lessons we've learned over the last 6 weeks?
We are all experiencing a black swan event, the never anticipated driving force that could threaten to destroy us because this virus most threatened the very population that we serve. Second, I don't want to ever go through another pandemic outbreak. It has tested all of our stamina, our grit, and general leadership abilities. However, through this process, our profession once again becomes a filter for who has great character and leadership skills and who doesn't. Leadership matters, and the most challenging moments in the last 6 weeks were when we had to deal with poor leaders, either our own, government leaders, or others. Now, finally, our staff has been nothing short of heroes. We have learned this early. They've shown up every day in the midst of an uncertain and most challenging time. And we need to make sure that they are recognized for that.
And now here we are. You know, for some of us, the worst has passed. For others, the worst might be yet to come. So what should providers be looking at now?
Yeah. So we need to be able to project out where the bottom is from a census perspective. High post-acute care facilities have been most damaged economically. The greater your average number of admissions per week, the worse your census has been damaged through this process. We can then see what our worst case financial scenario is and when it will end. And once we know that, we can project forward our new economic reality. It will be a combination of projecting how fast our average admissions will take to ramp back up to normal and the impact of a variety of government assistance programs. Now, there have been many positive nuggets occur in the last few weeks. There's been an FMAP 6.5% increase resulting in Medicaid increases for several states. CMS has given Medicare providers back the 2% sequestering cut. It's about $12 per patient day. CMS has also accelerated payments for those who are having liquidity issues. They've waived the 3-day hospital stay requirement. For SNF eligibility, that means we can skill in place for our COVID-19 patients. And then the CARES Act, which was a $100 billion stimulus package, was passed last week. The stimulus package will come in 3 tranches. The first will be a $30 billion tranche, and this is going to be for all Medicare providers and their Medicare patient days. It looks like right now it's about $100,000 to $150,000 impact for a facility, so it's material. Tranche 2 is going to be a $50 billion number, and this will be for Medicaid days and for Medicare Advantage days. Also will be a material number. Tranche 3 is yet to be determined. I don't know if it's going to be focused on COVID-19 hotspots or PPE costs. We're not sure yet. So CMS is also now has our 2.2% nursing home market basket rate increase in the notice of proposed rulemaking this year. That's material. And frankly, the threat of a cut or a budget neutrality adjustment on our PDPM rates has virtually gone away. Really good news for this year. Doesn't mean it's forever, but it is for this year. So with that information, we can now complete pro formas and cash flow projections. And then finally, we will need to be able to develop a plan for how to get from where we are to where we need to be from a cash flow perspective. At a big picture level, we've been fighting COVID-19, and now we have to start dealing with our economic survival. What does the future look like? But the good news is we have a lot of support that we didn't know about 2 or 3 weeks ago.
So given all of that, what do you think providers are losing sleep over right now, and what are some of the strategies to help get them through this?
Providers who have had material reductions in census or revenues are probably worried if their debt service load is very high or their loan to value is very high. I would also say that how a company is capitalized right now is going to be critical. Do you have the cash on your balance sheet to be able to get through these downtimes? How long will the downtimes last, and do you have the adequate resources for that? I think is really key as well. I think we all need to realize that no healthcare providers have not been touched by COVID-19. It has had a negative impact on virtually everyone's business model. And so we need to understand and be empathetic to everyone's position as we come out of this. We need to be transparent, we got to be collaborative, and we need to navigate through this crisis from kind of a survival mode to let's get back to normal.
Thanks, Phil. Obviously, we've only scratched the surface, and future newsletter editions will provide far more detailed information, featuring leaders across Consonus and Marquis with extensive experience and expertise. But we hope this conversation has given you a sense of the sort of resource we can be.
Absolutely. What we want to do is facilitate a two-way conversation with you. Find out what you need and what will be the most helpful. We don't want to make assumptions because your own path through this may have been far different from ours. I also don't want to make it sound like we've done everything perfectly because you know us well enough to know that that's probably not the case. But one thing I've learned in 30 years in this profession is that challenges and failures make you better and more resilient. That is a competency we've demonstrated as learning from a lot of mistakes. And so by pooling our knowledge and experience, I think we'll all be much stronger and be more prepared for whatever we face next.
So now we want you to talk to us and tell us how we can best support you. At the bottom of each newsletter, there will be a link for you to send us questions and let us know what topics you'd like to hear more about. Where are you in the COVID-19 crisis? What are your pain points and concerns? What additional information would be helpful to you? We will respond to those requests in a frequently asked question format in future newsletters. So Phil, any final thoughts?
Yeah, I remember a year ago we were doing PDPM trainings and we all thought that was the biggest deal we've ever dealt with, going to be really challenging and threatening, and we all got through it. Now we're facing more epic challenges than ever, and we'll get through this. But we need to continue to do whatever we can do to be partners, and I want you to know that we'll be there in any way we can.
Thanks for trusting Consonus as your partner, and we look forward to hearing from you.